Our next speaker is Datin Dr. Thema Abdul Majid, who is the Vice President of the Malaysian Society of Clinical Hypnosis and the Medical Director of LCCH Asia. She is a medical doctor, obtaining her medical degree from University Science Malaysia. Thereafter, she worked in Penang General Hospital and University of Malaya Hospital, primarily in the Emergency Medicine Department and Psychiatry Department. Dr. Thema has extensive experience working as a clinical hypnotherapist. She specializes in managing depression, addiction, PTSD, anxiety, and stress. She is also a lecturer for both beginners and advanced students of hypnotherapy. She conducts workshops, support groups for both future therapists and corporate clients. She is now spearheading the Psychological First Aid Task Force for frontliners. This is a project which requires a deep understanding of the mental health consequences of working during the pandemic. It provides training on self-care and resilience, both at management and executive levels. Dr. Thema is also a consultant hypnotherapist at the LSCCH Therapy Center and has been providing therapy for both corporate and individual clients throughout the pandemic. Her talk is titled Pandemic Fatigue, Taking Charge of Your Well-Being. Thank you.
Thank you, Tom. Thank you very much for that generous introduction. A very good afternoon and a good evening to everyone. Let me first share my slides. Okay, so my topic for today is pandemic fatigue, taking charge of your well-being. And as we all know, prolonged periods of stress can lead to complacency and fatigue. The initial enthusiasm to maintain the heightened state of alertness in any situation that requires vigilance and attention will soon start declining and eventually reach a plateau. What ensues is a gradual decline in the enthusiasm to maintain safety. Rules and regulations and less concerned approach takes its place. So what we have here is pandemic fatigue, and this is real. It is a real issue, a real problem, and it is being widely noticed in countries where the number of COVID-19 cases are seeing a steady rise. Most of us can relate to this, and it's not unusual considering that the pandemic is soon completing its second year. So the content of my talk today is as follows. What is pandemic fatigue? The definition of pandemic fatigue. What leads to it? What are the symptoms that we can see in a person who experiences pandemic fatigue? How does this threaten our health? How can we cope and take charge of our well-being? And finally, the role of hypnotherapy in pandemic fatigue. Now, on January 30th, 2020, the WHO declared the COVID-19 outbreak a global health emergency. On March the 11th, 2020, the WHO declared the COVID-19 a global pandemic. So we have had 24 months, almost 24 months of constantly changing and evolving safety measures, rules and regulations with an uncertain time frame. So if you are feeling less enthusiastic in coping with the many restrictions and challenges that are put forth before us that the pandemic has created, rest assured that you are not alone. And it is perfectly natural to feel fatigue about the pandemic. People are generally feeling overwhelmed while still having to maintain a constant state of vigilance. It is noted that 1 in 3 individuals is taking fewer precautions, and this leads to a threat to the individual's own health and to the public. Now, let us look at WHO's definition of pandemic fatigue. it is stated that it is a demotivation to follow recommended protective behaviors such as washing hands, wearing face masks, physical distancing, to protect themselves and others from the virus, emerging gradually over time and affected by a number of emotions, experiences, and perceptions. Now, this is a natural and expected reaction to sustained and unresolved adversity in people's lives. Now, let us have a look at this interesting chart. The chart shows how compliance with safety measures has decreased over time in countries. As you can see, there is a decline in vigilance over the months. The poll here is done from April 2020 to September 2020. It clearly shows that people have become less vigilant in taking care of safety measures. Now, what leads to pandemic fatigue? Before we go on, let us have a look at what stress response is. Now, stress response is a natural protective mechanism that aided survival in our ancestors. And stress causes stimulant hormones such as adrenaline and noradrenaline to be secreted into the bloodstream. And this is to initiate the fight or flight response. It is an automatic reaction and it prepares the body for immediate action in order to protect itself from harm. So what has happened here in the last 2 years is all of us, we have collectively entered a form of fight or flight mode. And this fear that we have created within ourselves due to the pandemic keeps us motivated. But over time, what happens is that the fear subsides. The initial passion and eagerness diminish. In its place, frustration grows, exhaustion and complacency ensue. And this is especially so since the end of the pandemic is uncertain. Now, what else leads to pandemic fatigue? Social isolation, being separated from family members and friends, overwhelming amount of COVID-19 news in the media, more than we can digest at times. Almost every news piece revolves around the pandemic in one way or the other. Diminishing trust in scientific authorities. As scientific evidences keep changing, leading in a change of regulations or understanding of the virus, frustrations tend to increase. And this leads to exhaustion due to the frequent need to adjust to new rules, protocols, and policies. Apart from that, lifestyle changes from going to the grocers to holidays. In the past, if you wanted to buy a loaf of bread, you just get your car keys, start your car, drive to the grocers, buy that loaf of bread, and you get back home. But right now, things have changed. The simple step of leaving the safe confines of one's home has become an anxiety-provoking decision. Apart from that, the unknown time period, boredom, complacency, and how we perceive risks has started to change. We are becoming more lenient as the time goes by. So what are some of the symptoms of pandemic fatigue? What we can see in our clients are feelings of being smothered and overwhelmed, boredom, extreme fatigue, lack of motivation to work or perform activities, physical and mental exhaustion, sense of loneliness, wary of standard operating procedures, and anger and frustrations, to name a few. One of our premier universities in Malaysia, University Kebangsaan Malaysia, recently carried out a survey from December 2020 to March 2021. And this survey was done by their Center of Research in Psychology and Human Wellbeing. It involved 2,047 respondents aged 18 years and above. Now, what they found was that 62.5% of respondents experienced pandemic fatigue, and this is indeed alarming. Now, over time, any form of fatigue can lead to one giving up. Fatigue here can be compared to muscle tiredness. The more you use it, over time, the more it hurts. And at some point in the pandemic, individuals may give up on taking precautions. And over time, what this leads to is that there's an increase in stress and anxiety, increase in anger and aggression, exhaustion, decreased levels of self-care, depression, insomnia, paranoia, conspirational thoughts and delusions, and burnout symptoms. Now, how do we cope and take charge of our well-being? First and foremost, we need to see how to bring some stability into our lives. And this can be done through time management. Time management is crucial during uncertain times, as we are able to control how we manage our time during the day and the night. And this gives us a sense of control over the things that we can do. So make sure to take breaks from work and studies frequently. Set clear boundaries between work and home. Most of us work from home now, and this can lead to chronic stress and fatigue as boundaries between work time and private time becomes blurred. Disconnect from your phone and laptops. Get sufficient sleep. Ensure a healthy, nutritious diet, and reach out to family members and friends on a regular basis. It is important to remember that ensuring physical distancing doesn't translate into social isolation. Apart from that, self-care can include practicing things that one finds enjoyable and promotes healthy living. Checking in with oneself is so very important. On a daily basis, ask yourself how you're doing and what you need. Acceptance and adaptation. Now, the serenity prayer comes to mind. Letting go of situations beyond your control, which is acceptance, and taking action towards things which are within your control. Understanding why certain measures are put in place and the rationale behind them. So understanding the benefits of the MCOs and the SOPs are important. Make a commitment to adhere to the SOPs because they are mainly put there for safety purposes. It is also important to stay flexible, important to be flexible with the protocol changes as we all know, it is beyond anyone's control. New scientific research is being conducted constantly, and new discoveries and guidelines will emerge as a result of this. So we need to stay flexible with all the recommendations that come by. Apart from that, it is also necessary to keep masks and hand sanitizers handy. Make sure it's easy to find your mask and your hand sanitizer, because if you can't find them, it's an extra step to have to go looking for them. So keep them in various places and spots so to encourage frequent use. What else can we do? We can recall resources that helped us cope in previous stressful situations and help us to improve our emotional state. So hobbies, leisure activities would come into place. Reach out for help from friends, family, therapists, or doctors, and refrain from unhealthy coping mechanisms such as increase in smoking, alcohol consumption, and substance abuse. Now, what are the things that the government, the authorities, and the media can do to help? Firstly, make mental health services to the public more accessible and affordable. Secondly, establish scientific criteria for the imposition of and lifting of restrictions. This makes it more predictable for the public and it decreases uncertainty. Media and news resources should practice responsible news reporting because the focus here is to urge the public to protect themselves against the virus, conveying accurate information and not in creating any form of fear. WHO has come up with these coping strategies. Number one, transparency. And this stresses on the significance of sharing accurate information to prevent any form of confusion and conspiracy theories amongst the public. Secondly, fairness, acknowledging the needs of all. Thirdly, consistency. There should be alignment between the actions of leaders and what is required of the public. Fourthly, coordination, consistent answers by those in charge. And finally, predictability, objective epidemiological criteria for the restrictions. Now, what is the role of hypnotherapy in pandemic fatigue? Now, over the last 2 years, hypnotherapists have noticed a 60% increase in online consultations since the beginning of the pandemic. For me, myself, I have shifted on to online therapy, and I've noticed there has been a huge surge in the number of clients who are seeking therapy online. And interstate and international borders are being crossed in minutes using the internet to reach out to clients far and wide. And this is one of the reasons why online therapy has increased. Hypnotherapy has also been effective in being used to treat anxiety, burnout, fatigue, needle phobia, and a host of other issues during the pandemic. Now, some of the recommended techniques that we use in therapy for our clients for therapy for pandemic fatigue are relaxation techniques, favorite place of relaxation, ego strengthening, personalized direct suggestions. We also incorporate anxiety and burnout scripts in our therapy. We address negative ruminations. We teach our clients how to practice self-hypnosis within the confines of their home. We help them create boundaries by using certain techniques over here, namely self-integration dissociation. This is a metaphorical approach to increase confidence and self-esteem and set healthy boundaries using dissociation. This technique also aids the client to recenter their locus of control. Apart from that, assessing resources using techniques like the library of life. Now, this is also a metaphorical technique where it is used to help a client to access inner resources. We also help the client to adjust the intensity of emotions using techniques like control room of the mind, which is again a metaphorical approach that helps the client to manipulate the emotional perception of their symptoms, be it psychological or physiological, and not forgetting breathing techniques as well. So I've come to the end of my slides. And before I end the session, I'd like to invite everyone present to join me in a short hypnosis session. So if you'd like to experience hypnosis, do join me in this exercise. This is a script that I frequently use with my clients who come to see me, especially during the pandemic, complaining of being unable to cope with life, feeling stressed, feeling anxious, and wanting better stability in their day-to-day existence. So all you need to do during the next 5 to 8 minutes is just to make yourself comfortable, close your eyes and listen to the suggestions. They are suggestions for relaxation, to be able to cope better during this period of our lives with increased inner strength and calmness, and be able to look forward to the future in a more positive way. So this will take about 5 to 8 minutes. And when I count from 1 to 10 and ask you to open your eyes at the end of it, you can then open your eyes and return to this discussion. And for any reason, if the internet does drop and you don't hear my voice for 2 minutes or 120 seconds, you will come back to full waking consciousness and I will reconnect with you. So get yourself ready and we can begin. I would like you all to make yourself comfortable. And whenever you're ready, gently allow your eyelids to close. Just become aware of your breathing. Inhale and exhale. Be aware of the air as you breathe in through your nose and as you breathe out through your nose. Give the air around you a color of your choice. It can be your favorite color. Notice the air with this particular color moving gently around you as you continue breathing. All the while, rejuvenating, healing, relaxing. And just feel all the muscles in your body feeling so relaxed. From the top of your head, right down to the tips of your toes. Relaxed. Imagine them letting go of all the nervous tension as the wave of relaxation flows through you. Effortless, deeper and deeper asleep. Just imagine calmness and relaxation flowing throughout your body. Peace and tranquility, feeling so wonderfully comfortable. And you may be aware of all the sounds around you, the sounds from your surrounding, or the sounds from the internet. And I want you to know that these sounds are unimportant and you can just disregard them in your own way. You may find that in a strange and curious way, these sounds may help to take you ever more deeper relaxed. The only sound of importance that you need to focus on is the sound of my voice. As I take you deeper into relaxation. And now, feel yourself going even deeper into relaxation as all the muscles in your back relax. Deeper and deeper. And over the course of the next few minutes, during the time we are together, each time I say the word deeper, you will find yourself relaxing even more, relaxing deeper into the hypnotic state. For the changes you have chosen to make today, you are allowing yourself to go into deeper concentration, a deeper state of focus than you have ever imagined. You can feel yourself now going even deeper within yourself to a place where all things are possible. Your focus and attention will become even deeper, more precise. Just notice what it's like when every part of you is replenished with deep calm and peace, feeling so rested and comfortable, calm and peaceful, happy and contented. Really get a sense of resting so completely. Relax even deeper into the hypnotic state. And I would like you to know that as each day goes by, you are going to become a little calmer and serene. Clarity in your mind increases each day. You are going to be able to think more clearly, see things more clearly. Your mind becomes crystal clear, more focused. Confidence within you grows. You feel self-assured, stronger in your mind and body. And as your confidence and inner strength grows day by day, you notice how much better you feel. You will feel more relaxed, more focused, more at ease with yourself and at peace with the world around you. You will be aware that you feel stronger and clearer in your mind, more able to make decisions, more capable too. You will value and appreciate yourself more and appreciate the world around you. You are going to be able to cope better with anything and anybody and any situation that life presents to you. Cope better with the challenges that life may bring. You will have greater control, greater self-control over the way you think, the way you feel, the way you behave every day. You are going to experience a greater feeling of well-being, physical as well as mental well-being, a greater feeling of safety and security too. A greater feeling of safety. And you will find that these positive feelings continue to increase every single day. You will notice that calmness, confidence, peace, clarity, good health, and strength increase day by day within you. Life is unfolding before you in the most fulfilling, satisfying, and wondrous way. And now I'm going to wake you. You will hear me count from 1 to 10. You will slowly awaken with each number. And at the count of 8, you will open your eyes. And by the count of 10, you will be fully wide awake. You will wake up feeling fine with a feeling of well-being all over, a feeling of well-being. Every part of your mind and body will be back here with me in the present, and all normal sensations will return to every part of your body. And you will be fully wide awake at the count of 10. You will feel fine, refreshed, feeling better and more optimistic, and you have felt in a long, long time. So ready? 1, 2, 3, waking up. 4, 5, 6, waking up. 7, 8, open your eyes, open your eyes. 9, 10, wide awake, wide awake, wide awake. Welcome back. I hope that session was beneficial, and I hope it has been an enjoyable experience. And I'd like to end my session by saying that it's important to take care of oneself and each other for the wellness and mental health, and to optimize our mental health resources in order to get through this very challenging and difficult time together. Thank you.
Thank you, Dr. Thema. I think it'll take some time for people to awaken and put their questions in. Let me just have a quick look. That was really relaxing.
I was rushing a little bit because I can see that the time is... Yeah.
I think, it would be great to actually just hook up online and have this, because it's really it is very re-energizing to have sessions. Sometimes we do it for our patients and we don't have the sessions. So.
Absolutely, absolutely.
Yeah.
It's something that we can take back with us, because we as, healthcare professionals, mental health care professionals especially, we tend to run into burnouts as well. So taking care of ourselves, asking ourselves what we want, what we need is very important. And going for therapy once in a while to listen to ego boosting, relaxation, coping mechanisms is also equally important.
Yeah, I think with the challenges, we talk about the vaccination and healthcare workers having to deal, because we don't have that much data. And then you talk about the conspiracy theories, and we are unable to sort of give our patients the answers. And that is actually, it definitely makes us more anxious, because we don't have the answers as well.
Absolutely. So the best thing is to let our clients know that control what they can control, and the rest to accept and be able to adapt to the situation. So that's the best thing we can do right now.
Okay, I've got one interesting question here from E. Moon. What does it mean if I have lots of tears during the hypnotherapy just now? I think your session, as I said, I think your session was definitely much needed for. So yeah.
Tears are good in the sense that it's a form of reaction. We are just expressing our suppressed emotions within. You know, the more we go through this pandemic, there are a lot of emotions that we tend to push inside and suppress in order to face the world day to day and be there for our loved ones and our friends, family, our clients, and so on. So when we are deeply relaxed, these suppressed feelings do sometimes come to the surface. And it is good because it actually helps us to release that stress and be able to replenish ourselves and get energized and be able to move through this period in a better way.
Okay, we are almost out of time. We will be sending you the questions. I think there are one or two new questions. We'll be sending it to you. With that, I'd like to thank you so much for the wonderful session.
Most welcome. What I can do is actually I can record this and put it in an MP3 and maybe.
Yeah, that'll be great.
Okay, all right. Thank you so much.
Thank you.
Thank you.